Conversations That Matter is a partner program for the Centre for Dialogue at Simon Fraser University. The production of this program is made possible thanks to the support of the following and viewers like you.
Welcome. In 2016, when we take a look at lifestyles for men in North America, are we as healthy as we can be? Are we getting the most out of life that is there to be offered? And if not, why not? And what can we do about it?
I think it's a great question. When you think about men overarching, all men, I think you could point to some pockets where certain groups of men maybe aren't doing health as well as they could. And maybe it might be about not having the money or the resource or the access. So there's spots where we see lots of challenges for men that maybe they aren't able to do health.
Well, what would some of those spots be?
I think, we often talk about choices, and I think diet's a great one. Talk about food, and we say, make the healthy choice.
Yeah, nice idea.
Yeah, and depending where you live, there might be a whole check or a whole food store, or there might not. And then you might have the money for that, or you might not. And so those choices, a lot of times, you can buy cheaper and eat, sugar-laden, fat-full, kind of foods. And so it's not always about choice. You might not have the money to do it.
Are there different considerations for men when it comes to diet? Like, are we raised to think about it? Are we told not to get too worked up about our diet? Oh, there you go, eating healthy. Like, is there some of that kind of component in a man's life that makes them go, oh, what do I care? I can do this.
Yeah, I think historically it's been about getting full and getting fueled. So it's been bulk and it's been fueling up for men. And it's interesting, now we're starting to see younger men move towards more of an ideal in terms of body, in terms of lean and muscular. And so their food choices are changing a little bit. So again, it depends on generation, it depends on context, but I do believe traditionally guys are raised to kind of eat the stuff that can fill them up, to give them the energy, to give them the drive to do their work, their sports, those sorts of things.
Any idea why younger men are now gravitating towards healthier choices, which is a good thing?
Well, they're healthier choices in some respect, but some of the body image issues are not necessarily driving good practices. So the ideal about being slender and muscular is a very difficult physique to try and come up with, and a lot of young guys are going after it with supplements. So, in pure knowledge around good food, yes, there is better awareness, but also some of those practices that are getting driven by wanting to look a certain way can pose some problems for some of our younger fellows.
So as we look at the arc of someone's life, especially a man, what are the health issues that are different for them that seem to shorten their lives compared to that of their female counterparts? Sure. What are we as men at risk of dying from? That means that overall we've got a shorter life expectancy.
Yeah. The way I try to think about it is, in British Columbia, for example, women live 4.7 years longer than men. And I look at the disparity, what contributes to that, and there's 5 things. It's cardiovascular disease, it's suicide, it's motor vehicle accidents, it's infectious diseases, most often HIV, and it's liver failure, most often secondary to alcohol overuse. So they're the things I think about in terms of that disparity.
Mm-hmm. So cardiovascular goes back to what we were talking about, diet and lifestyle.
Yeah, diet, exercise, those sorts of things, and food choices, if you've got choices. So yeah, for sure.
At what age do we see that cardiovascular, calling card come home to roost?
Yeah. So for many guys, we might pick them up in their 40s and their 50s. That young, but it's really some of the damage has been done, and some of the lifestyle issues have been done earlier on. So the things that you do in your 20s and your 30s, they matter for middle age. Mm-hmm. And I think that's some of the challenges, right? To try and suggest that to guys, when they're feeling pretty good, no real problems here, and feeling energetic and a little bit vulnerable, you know. I think, yeah, it can
You
be...
mean invincible, feeling invincible, yeah.
Yeah.
Holy smokes.
Yeah.
You know, just a point of clarification. What is you said 4.7 years difference, but what is the life expectancy for a man versus a woman in British Columbia?
Yeah, rough figures, it's around 85, 86 for women, 82, 83 for men. So we're all living longer.
Well, it's still pretty good.
It's a good deal. It's a good deal. You know, we are living longer, and I guess it's about quality of life at a certain point, trying to you know, keep people enjoying their life for those years, because more and more of us are getting into our 8th decade, yeah.
So 40s and 50s cardiovascular, but post 50s, what's the single biggest threat for men? You mentioned suicide. Why? What happens that make men start to become more vulnerable as they're aging to suicide?
Yeah, I believe there's 3 things. We talk about them a lot these days: injury, interiority, and isolation. So injury, we talk to a lot of men who have had suicidality, you know, plans, thoughts, some attempts, and they tell us that they've experienced injury, oftentimes childhood injury. So
now, are we talking physical or are we talking psychological?
we're talking across the gamut. So things like growing up in a household that was a little dysfunctional, parents that might not have been there might have been sexual abuse, there might have been a whole array of issues. And the major problem and challenge for a lot of the guys is that they're not resolved. The problems stay. So they never really recover from the injury. And then as you go on, you accumulate more injuries, whether it's leaving work or retiring or a relationship breakdown. And so that all adds. And so the interiority of that is when they drive their problems inside, don't talk about their problems, and they try to work their way through their problems. And the most often used remedy amongst men is alcohol. They self-medicate with alcohol when there's a problem that they can't resolve.
So that's escape.
That's escape in a form, but it can also be blunting some of the things that they're actually feeling. You know, some of the pain they're feeling around, it could be depression, could manifest in a whole bunch of different ways. And then the isolation, I always find interesting, because when we talk to the fellas, we have this idea that maybe if a guy's isolated, we have this picture of the bloke in the corner who's sad and lonely. And the number of men that talk to us who are deeply connected, have lots of people around them, lots of success, but are completely isolated, is amazing. So they talk to us about it. They say, well, you know, I've got people around me. I seem to be doing okay, but I'm not. And I'm not connected.
So why? So what's missing for them there? Even though they're in a community of people.
Yeah. Well, I think sometimes, you know, if you go back to the injury and the injury is not really resolved, if you're ruminating really about what's gone on for you, then it's very hard to move things along. So you might be functioning at some level and doing quite well, and then you might be like that for a long period of time, and then it might eventually sort of just catch up with you.
Got to get you to hang on for just 1 second while we take a quick commercial break. We'll be right back.
Conversations That Matter is a not-for-profit program made possible thanks to the charitable support of the following and from viewers like you. Please visit conversationsthatmatter.tv and help us to continue to produce this program.
By not addressing these issues, are you saying that what happens is they start to build walls around themselves that isolate them from someone else for fear that someone else might hurt them?
Absolutely. So there is some self-protection in it, for sure. So most of the injuries that the men talk to us about were at the hands of other people. And so they weren't necessarily, there are things that you and I might get past or might get over, but there was a sensitivity to things that had happened and unresolved.
And so it could be anything from taunting and bullying to not getting good grades and having a parent that was expecting better.
Yeah.
Wow.
Feeling like you couldn't necessarily attract a partner, feeling like you had been rejected at some level. So, and of course, there's other things that play into this. You know, you can be prone to injury because you might have, you know, a predisposition to some sort of depressive symptoms and the like. But just to say, it's interesting that they're the 3 things that we, time and time again, when we talk to fellas who've experienced depression and suicidality, they're the things that come up.
Aren't you talking about all of us, though, when you say that? Like, I think, well, there's things that have been traumatic for me in my life, and I go, "Ugh," you know, and I don't really necessarily want to go near them. So how do I deal with that if in a way you're talking about everybody?
Yeah, I guess some folks are built with some resilience and they develop some resilience and they're able to get past. And so it could be that you can absolutely manage your own injuries, you know, in an effective way, and keep moving through and look back and go, yeah, that was a hard time and I got past it. But it's not the case for for all men. And of course, when we talk about suicide and men are suiciding at 4 times the rate of women.
What?
4 times the rate of women in Canada.
Now, are you talking about over the course of their life or within specific age groups?
Across the board. If you average it, it's around 3 to 4 times the number of men will suicide compared to women.
Oh my gosh. That's a sad statistic.
It is. It is. Yeah. And so we worry that men don't get help, but also sometimes it's very hard to get help.
Right. So what do you do if you grew up in an environment where you don't have access to that?
I think you can get some strategies. I think you can be helped with some strategies. You know, thinking about things differently, trying to work your way through issues, having someone that you can really work with, you know, and it can be a professional or it can be a skilled peer to help you through. And I think, you know, I do think there's ways of learning strategies, you know, that can really help men. I know that some guys really don't want to reach out for professional help because it might attract a label of depression, and that might then give them difficulties, or they might think they're going to get some difficulties around work, for example. But you know, it's kind of, sometimes there's some other strategies out there that you can pick up even off the internet. We've got a website called Heads Up Guys. It's full of video-based resources. You can check your own symptoms. We can guide you towards strategies and ideas that might help you. And again, no one needs to know. You know, you can actually be self-sufficient. And for some guys, that can be incredibly helpful.
When you say we, who are you talking about? Like, we have a website, Heads Up Guys, and who are we talking about? And tell us a little bit more about the work that you do that can help men deal with issues like depression. And then we'll get on to a couple of the other reasons. But let's talk a little bit about what the work is and that you do along with your team. Yeah,
we were so fortunate. We were funded by Movember back in 2013, and they gave us $3 million, and we had 5 programs that were all addressing men's depression and suicide. And one of those programs was the promise to build a website that would be for men, that would allow them to come into a space and be anonymous, be confidential, to be able to pick up some ideas about how they might better deal with their depression or depressive symptoms. And we also had a little spot there for partners of men as well that they could go to and have a look. And so that's one of the projects that we put together.
What's the overall team called?
The Men's Depression and Suicide Network, it's called. Yeah.
That's repeat that again.
The Men's Depression and Suicide Network, and so we put together 35 people, 15 investigators who'd done a lot of work in men's mental health, and 20 staff, and I feel like we've done some good work. You know, there's a lot more to be done, but we've done some work in terms of at least naming male depression, and we've talked about how it can manifest differently. We've talked about how irritability, anger, substance overuse, violence can all be manifestations of men's depression. So we've managed to sort of do that and try and destigmatise it, and then we've really tried to offer some community-based resources to help guys, you know, through those hard times.
This is very interesting information. Unfortunately, I've got to take a quick break. We'll be back in a moment.
Conversations That Matter is a not-for-profit program made possible thanks to the charitable support of the following and from viewers like you. Please visit conversationsthatmatter.tv and help us to continue to produce this program.
What's the response been? How's it going?
Yeah, we've been pleased. The website, for example, has attracted 50,000 views, unique visitors in 10 months. In academic terms, that's pretty good traction for us. And the guys are filling out the self-appraisal, you know, self-evaluation. So they're doing a good job with that. So they're actually coming into the interactive parts of it. So we'll be able to say something about the men who have used it fairly soon. And I do think that we're filling some kind of niche. And because traditional healthcare services, they can be quite challenging to access, you know, especially mental health care services. So this provides another way. And ideally it would augment those great services, the public healthcare services.
Okay, so we talked about early childhood trauma being compounded through life. What are some of the other factors that can affect men as they're getting into their late 50s and 60s, which is, I understand, another time or a point where men are particularly vulnerable to saying, well, what do I matter any longer for?
Yeah. We're very, you know, we are youth-centric, you know, and so...
Even with the bulging baby boomer population.
Yeah, well, you know, I mean, even that, I read things about the baby boomers being the bottleneck.
Yeah.
For jobs, you know, so in some ways, I think for a lot of guys when they get into their 50s and 60s, I think it can be hard because you might be coming to the end of your working career, or you might be feeling as though you're coming towards the end of your working career, and a lot of men's identities are wrapped up in what they do, so that can be challenging. I think if you think about the economic sort of environment at the moment, I think there's a bit of pressure to work longer. For a lot of guys, you know, want to hold on a bit longer and keep that, you know, keep that money coming in. So, you know, that breadwinner piece that might have been attached to raising a family might actually be extended now, you know, because some of those kids are still at university too. So there's lots of changes, and so I do think that
might be a good thing.
Sure, sure, but they might not be going into work as quickly as probably previous generations. Is
retirement a big challenge as far as depression is concerned?
I think it can be. I think it can be very hard, because if it's given you purpose, if your job's given you purpose and you've had routine, then you know you've got to really reconfigure what it is you've done. If you didn't really have social connections outside of work and it was kind of your primary focus, I think it can be hard, and so it can be quite isolating to finish work for some guys. And whether that's depressive symptoms, which are, you know, feeling a bit down here and there, and not necessarily a full-blown depression, so to speak, I think they can trouble fellas. Yeah.
So what if I'm a wife, you know, a child, someone who cares about somebody? What are some of the warning signs that I need to look for that my father, my partner, or whatnot might be in trouble? And so what should I look for, and then what can I do to help them?
Great question. So the things that we see early on in depression with men: anger, irritability, violence, alcohol overuse, over-involvement in sports and work.
You're almost talking about PTSD.
Well, yeah. So, you know, so when you're noticing those as a pattern in the men around you, then absolutely, you know, I think you can raise it, because one of the issues is that men might not have insight into those things creeping in, right? And
well, I know sometimes you're not aware of what's changing within you.
Yeah. So it's an objective kind of point of view where someone's saying, "Hey, I'm noticing this. What do you think might be going on?" Like throwing it open. And we find oftentimes when you give a man permission to talk about those things they don't ordinarily talk about, it can be quite liberating. A guy can start to have conversations he might not normally have. So there might be something that he is aware of, there might be something that he's feeling, and then start to try and leverage him towards services or managing. You know, I think it's important not to take it on as a partner.
How do you know how to do that anyways?
You don't necessarily, but there's a long tradition of women looking after the health of the men in their lives. And it's well intended, and it's all wrapped up, I think it's wrapped up in feminine ideals, but it doesn't necessarily help.
I almost hate to have to ask you to wait again, but one last break. We'll be right back.
Conversations That Matter is a not-for-profit program made possible thanks to the charitable support of the following and from viewers like you. Please visit conversationsthatmatter.tv and help us to continue to produce this program.
There is, and I get confused about this, if I feel that somebody is suicidal, do I confront them about it? Like, do I say, have you thought about suicide? Do you have a plan?
I believe if you know that person well enough and you feel comfortable enough, you should be able to say, do you think about self-harm? Are you thinking about self-harm? You know, what's going on for you? And I say that because the guys who we speak to, again, it's the permission to talk about something that's very taboo.
Oh, yeah.
You know, to talk about self-harm and to talk about wanting to end your life is very, you know, it's not something, it's so wrapped up in stigma. So the freedom to be able to say, yeah, I'm thinking about it, I'm not really making plans, but I've thought about it a bit. You know, it just opens that conversation up, and I think it's very important.
Which goes back to a point that you made earlier, and then it maybe gives them an opportunity to start to think differently.
Yes.
And that's the fundamental change, isn't it?
Yeah, you can do a lot by just reaching out. You know, when we put guys in situations where we just ask the open-ended question about how they're doing, and really are genuinely interested, it can work really well. And it seems like such a basic thing, but when you think about guys' stoicism, oftentimes they don't look for those opportunities or don't know even how to garner those opportunities for other fellas. So it's kind of just those open-ended questions can make a real difference.
So we've talked about cardiovascular, car accident, you know, I understand that.
Yeah.
Depression. The two other reasons why men are not living as long as their female partners.
Yeah, we talked about infectious diseases, most often HIV, and we also talked about
But HIV, we're in a world right now, especially here in North America, where we have a much better handle on being able to control that. We don't see the number of deaths related to HIV that we did, let's say, 20 years ago.
Yeah, agreed. So chronic, more of a chronic illness, certainly much better managed. Number 5, we talked about liver failure, most often secondary to alcohol overuse. It's funny, isn't it? Because like they're connected, right? Cardiovascular is connected to alcohol. So even though we come up with the different biomedical terms, I'd say that, well, some of the alcohol overuse, you know, you could connect to the suicide, you could connect to the motor vehicle accident. So they...
To state of mind,
Yeah.
Are you hopeful that we're going to get better? Like, not just because of the work that you do, but from a societal perspective, are we going to get better at addressing these issues for men?
Yeah, I think... I really am very hopeful, and I look around in British Columbia especially, and I go, gee, we've got some great examples of guys doing good things for their health, and the flow on to women and kids and other men is great. So a good outcome for a man has flow-on benefits to everybody in terms of health.
What's the website address that people can go to?
Yeah, it's www.menshealthresearch.ubc.ca.
Thank you very much for doing this and sharing these insights.
Nice to talk with you.